The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don Mckintosh, and we're glad that you joined us today for the program. We're going to be talking about hives and things that mimic hives today. And talking with us about this very practical subject is Dr. David DeRose. He's a physician from southern Oklahoma, and Dr. DeRose has a ministry that's web-based. It's called compasshealth.net. And many of the things that we talk about today will be able to be referenced there on that website.
That's exactly right, Don.
How did you get into the ministry that you're involved in now?
Well, Don, I'd been a physician for probably 15, 18, maybe 20 years. I hadn't really thought about how long it had been when I started Compass Health, but the ministry has been going for about 3 years. But before that, I'd been doing a variety of things, especially emphasizing more natural strategies for disease treatment. My board certifications are in both internal medicine and preventive medicine, and I've worked in a variety of settings using those skills. But the real vision I had, seeing how many people could be helped by these more natural therapies, and then really trying to translate it into something where it was just more than what I was doing individually, getting more things out through media resources, seminars, things of this nature, and Compass Health was really set up to accomplish that.
Great, and that's a great resource. I've visited the website a number of times, and it's been very useful to me. Let's talk today about hives. Hives and conditions that mimic hives. What are hives? Do a lot of people have this problem?
Well, hives, typically people think of them as being associated with some type of allergic response. It's actually much more common than many people realize. A lot of individuals say, well, what is a hive anyway? These are reddened, raised areas that typically are triggered by anything from foods to other allergic exposures, medications, other common triggers, and they tend to be itching, they tend to move, they don't stay in one spot for days, they tend to move around on the body once they've kind of raised their ugly head. So hives, or urticaria is the technical medical term that we use.
Urticaria.
Urticaria is something that's quite prevalent.
So a lot of people have it, and so they're the type that move around. They're not like shingles. Shingles stay in one place.
Exactly. This is one of the things that we use to differentiate it because, whether it's shingles, whether it's a typical eczema, that if you circle the lesion, you circle the spot, one of the abnormal spots, yes, with shingles, with a patch of eczema, that's going to stay in that same spot as long as you have the problem. Whereas with the hives, especially if you've been exposed to a medication or you're continuing to take the medication, not aware that it's triggering the problem, you'll find that patch that you circled has become normal. And now some other area is raised, red, and itchy. So if you look across the board, probably about 20%, 1 in 5 Americans will have a bout of hives at some point in their life. So it's definitely something worth spending some time talking about. And it opens up, Don, this whole dialogue that is so needed with autoimmune diseases, because some people have chronic hives. It's actually an autoimmune process.
So what causes it? Food allergies?
Well, the acute urticaria, the acute hives, food allergies is a big contributor. And of course, hives is on one end of this allergic spectrum. No one dies from hives per se. But more severe allergic responses, for example, to a food can cause what we call angioedema. This can involve swelling of the face, the lips, the oral tissues, the tissues in the throat, the oropharynx, nasopharynx. And if those swell, especially in the laryngeal area where your breathing is being negotiated.
Breath.
That's
flow.
right. People can die. Anaphylactic shock is another extreme example of just this continuum of more severe allergic reactions that can occur with anything from contact exposure to something chemical that you're exposed to medications, to foods.
Medications? What about?
Definitely.
They trigger it as well. What?
Oh, I mean, one of the most common causes of urticaria that we often hear about are antibiotics. And whether it's the penicillins or the cephalosporins, I mean, many people are allergic to antibiotics. It's typically not the first time they take that antibiotic, but it's after they've had some exposure, then their body has become more sensitive to it and mounts one of these overwhelming kind of, or you might say overkill responses involving some immune cells that normally don't need to be activated.
So now we want to figure out, how to figure out maybe what's causing hives, and you've talked about the fact that the things you're sharing now only should be done under the direction of someone who's a physician or someone that is a healthcare provider, because you don't want to be stopping or starting medications on your own willy-nilly.
Well, I mean, if you have hives and you're on medication, I mean, this is an emergent situation.
Mm-hmm.
You want to call your doctor right away. You're exactly right. You do not want to stop the medication, but by the same token, you don't want to keep taking any of those drugs that may be contributing to the problem. So this involves some real clinical judgment, some expertise from the physician to say, look at what have we just added? That's often the first thing to look at. But if you're on a number of chronic medications, they may look at rearranging those as well as looking at diet and other factors.
So you want to look at two things here, food items and non-food items, in terms of this, dealing with this issue.
Exactly. It might be even more useful to categorize it in three ways. You've got the food items, and then among the non-food, you look at medication as a separate category, and then maybe specifically looking at things that you're in contact with that you may not think of. You may not be ingesting them. It may be the laundry detergent that you're using. It may be some jewelry that's containing nickel, which is a common allergen sensitizer. So some things like this that you may not think of as being medication related.
So the non-food items would be, like you said, fabric softeners, cosmetics, makeup?
Those things would all be on the list. And the special concern should be for anything new, realizing, though, that something you've been using habitually for a period of time, you could have developed a sensitivity.
So that makeup that they put on me before we started the show, my good friend who put that on me could be leading me to hives.
It's possible. It's possible. Now, I'll tell you.
They seemed so nice in that room when they were putting it on.
They were very nice to me as well. But Don, let me tell you that this whole dialogue about sensitivities is just the urticaria, the hives issue, is just a small piece in a much broader dialogue, because what a lot of physicians are believing right now is we're seeing a lot of food sensitivities, food intolerances, and other things that we may not have typically put in the box, if you will, of allergy. And allergy typically relates to an immune cell or an immune compound called IgE, immunoglobulin E. That's what we usually think of being activated in these kind of flagrant allergic things like hives and angioedema. But there are probably many other food intolerances that people are dealing with.
So, I mean, fabric softener is not a food, at least I hope not. Cosmetics is not a food. Jewelry is not a food. You put down here also rubber or latex gloves and stuff. That's not a food. These are the non-food things you have listed here as part of the web page. But anything else in terms of non-food items to just completely avoid?
Well, I'll mention one thing. There are some things that are common sensitizers. We talked about nickel just briefly. But another one is the drug neomycin. Now, this is not an oral medication. Neomycin is commonly put in these broad spectrum antibiotic creams.
That you rub on.
Yes, you can buy them over the counter. Many people will develop a sensitivity to this. So I recommend that people stick with more simple prescriptions. Don't use the triple antibiotic when you can just use soap and water. And don't use a triple antibiotic when you can use a single antibiotic. So, you know, just some rules of thumb. Don't, you know, we get in this mindset of overkill. If a little's good, much more is better, and that's where we get into problems.
The more is not necessarily the merrier. It might be the scarier.
That's exactly
so
right.
Antifungal agents, those sometimes are very related to hives. And
I mean, definitely. Anything, especially, think about it this way. You put on the broken skin, you're going to increase your risk of problems. The other thing that a lot of people don't realize is if they've just taken a shower or bath, the pores are open, they're actually much more likely to have problems with something that they put on their skin at that time.
Any plants that we should avoid? I mean, pretty obvious, poison ivy, poison oak.
Yeah, I mean, but this is an interesting topic you bring up, because a lot of people have these contact allergens, and you know, the poison ivy and poison oak, Don, sure, we say, okay, I'm allergic to poison ivy, stay away from the poison ivy. But you know how many people get poison ivy rashes who never touch poison ivy?
How do they do that?
Several ways.
Let's hear about them.
Okay, one of them is through pets.
Pets.
Yeah?
A pesky pet.
Well, I wouldn't call it a pesky pet necessarily, but your beloved cat.
The beloved cat
is out there hunting mice or whatever it's hunting, and has a great time hiding in the poison ivy. Well, what do you think happens when you're then sitting with, you know, Fluffy, petting Fluffy?
You start to
on your
get
lap?
puffy.
That's right. That's exactly what happens. Another setting where you get exposed to these things is the bonfire or the fireplace fire.
Ooh, another goes in the smoke and it wafts into your nose and causes hives. Or
it could cause hives. It could cause other contact dermatitis, just depending on how your body responds to that poison ivy or poison oak or poison sumac.
Never thought about that. What about mowing the lawn?
Okay, now mowing the lawn is usually not a problem with poison ivy unless you're mowing over the poison ivy, of course, and that can be a problem. But also the grass and the grass seeds, pollens, whatever, can be aerosolized when you're doing that.
Aerosolized?
Yes,
what?
put into the air.
Oh.
Okay, and then you can breathe them in, you can get on your skin.
Self-medicate.
Well, or self-allergize, whatever the terminology might be.
Okay. So wow, so we have to be careful if you're out there burning the fire and doing those different things. That could be the real reason that you're having these hives.
I mean, there are lots of ways that we're exposed to irritant compounds that can trigger allergic reactions.
Well, you know, what about, you know, a lady that has all the different kind of soaps and jellies and all the different things in her cosmetic cupboard? Can those be causing hives?
Well, they can be. The challenge is, you know, many of us, we're exposed to all kinds of chemicals every day. And let's face it, even though the statistics are high, 1 in 5 Americans developing hives at some point in their life, it's not like all of us are walking around with red, itchy bumps all over us, right? I mean, they didn't have to do that much work on our makeup jobs today, did they?
Well, not as much as we would have originally thought, but yeah, right.
So what the point is, though, is yes, these are common, but we're exposing ourselves to these laundry detergents, these fabric softeners, all kinds of foods that we're eating from all over the world. And it's not like, you know, it's, how are the hives today, friend? Or, you know, you greet somebody. So we just have to keep that in perspective. It's not to scare people away from all these things, but to say, look, if you are having a problem,
look at all these things.
Yes, the list is actually a broad list that you've got to look at.
Now, you even put down here hot baths or showers.
Yes, and that's because there's something called cholinergic urticaria.
Cholinergic, which is like a reaction of the body, the cholinergic system.
The body actually, heat can actually trigger hives in some people. Other people get hives when they get cold. So there are a number of physical things that can trigger hives. So when we're speaking about hives, this isn't always conventional allergy. And so I'm glad you bring that up, because, you know, this is important to realize that you could, you know, just getting into that hot shower could trigger a very serious reaction.
We've been talking with Dr. David DeRose, covering information on hives, what causes them, what to do, what things specifically to avoid or to go down. Again, the list that we're sharing here are available on compasshealth.net, and they also should be a list you don't really go through without having some assistance from a healthcare professional. When we come back, we're going to look at some other things we can do to avoid hives. Hope you join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. David DeRose. We're talking about hives, very practical subject. Hives are differentiated from other types of skin problems by the fact that they move all over the place. Isn't that right, doctor?
Yeah, it's basically a lesion that doesn't stay in the same place. We have this outbreak, if you will, that's related to the immune system and not to something specific with one point on the skin.
So when the old saying, does it hurt all over or just in spots? I mean, if it's all over, it's probably hives because it moves all over. Just in spots, something else.
Yeah, that's a good way of looking at it, probably.
Maybe not, but at least it gets us started. You said there's also occupational hazards or exposures that we need to be aware of if we're trying to figure out why we have hives.
Yes, I mean, if we think about it, if we're talking about an immune-related phenomenon, and that's what this is, anything can trigger that. So we've been speaking about this broad list that includes everything from foods to medications to things in the environment.
Hot water.
Yes, hot water with cholinergic urticaria, exactly. Occupationally, whenever we talk about allergic responses, we always have to consider the work environment. And one of the best tests you can do is take a vacation.
Yeah, don't go to work.
That's exactly
right.
You
heard it here on 3ABN.
If you're gone for several days, a week, over the weekend, the symptoms go away.
Could be work.
That's right. But they return when you go back to the workplace. I mean, that's the classic scenario. And this is not just true for hives. People with cough, chronic cough, can be an asthma variant.
Okay.
And
this is why you do it under a doctor's direction, because you don't want to lose your job. The doctor says, I'm going to take off a few days to see if this is causing my hives.
But often what we'll do is we'll just simply ask, what happens on the weekend?
Oh.
I mean, presumably you're getting a weekend off, or you're getting a week vacation off. What happened then? And it's the same in the home. If we're concerned that there's something in the home, Don, that's triggering an allergic process, whatever that allergic process may be, whether it's hives or something else.
So what do we do for hives then?
Well, basically, first you try to get a diagnosis. What is causing the hives?
By working through all those things you've talked about.
Yes, and actually a dermatologist, an allergist can actually do some very specific testing.
With all those little picking you with
yeah,
all those,
there's a variety of different ways of testing for allergens. Really, one of the tried and true mechanisms is the one that you're not all enamored with which is the skin testing mechanism.
Does that really hurt? It sounds like it hurts.
Well, I mean, I've had allergy testing done, and I don't recall it being a bad experience. It was a while ago. I didn't try to have it done the next day. Something to look forward to then, maybe.
But especially if you're having a problem.
Exactly. I mean, because here's the point. I mean, sure, someone says, I don't want to be pricked in a bunch of places, or, you know, I don't want to have a bunch of blood work done, or I don't want to spend the money to see an allergist or a dermatologist. But and maybe I should stop and say something here, because allergists and dermatologists are two excellent groups of specialists who deal with these diseases. And although an internal medicine specialist like myself, or a family practitioner or a GP, they may be able to pin down the cause pretty obviously. It may be very straightforward. They just started you on penicillin and you broke out in a rash. You don't necessarily need to see an allergist for that. But by the same token, those two specialties come at the problem often from a little bit different perspectives. So if you've seen an allergist who hasn't nailed down the problem, see a dermatologist, or vice versa. The key is to try to find an answer to what's causing the hives.
So once you diagnose it, is there another way? I mean, do you ever just take people's food away one at a time or something like that?
Well, actually, many times they will not be able to diagnose the cause. Now, I'm not saying 99% of the time or 90% of the time. Many times they will diagnose it. But oftentimes the cause of hives, especially chronic hives, can be somewhat elusive. And so then we've got to say, well, what kind of strategies are we going to use to try to see if we can find out what's causing this? Because really, this can be a very miserable existence for someone to have chronic hives. It can actually be caused from an autoimmune disease. The body can be attacking this IgE receptor, triggering these immune responses. So that actually can happen.
So what do you do then? You, I see here you have listed on the website here, you know, elimination diet.
Okay. Now, elimination diet is on the website, not just for hives, but it's on the website because...
All kinds of things.
All kinds of things. We use elimination diets when we're dealing with difficult problems to diagnose what's triggering them, or problems, usually they have some kind of inflammatory or autoimmune component, and we're trying to say, look, there's some evidence in the scientific literature that foods may be common triggers of this condition. Maybe we're talking about rheumatoid arthritis. Maybe it's asthma. And maybe it's hives, chronic hives. And we're going to try an elimination diet to see if this can cause an improvement in the symptoms. If it does, then it's pointing us down the direction of the foods that we've eliminated, one of those foods or a number of the foods being the triggering cause.
Okay, so do you have a way to go through different foods on this thing? Do you know, start with your corn chips, then go to your potato chips, then go to your whatever?
If you did it that way, think about it. If you went down one food at a time, if you have a triggering response to more than one, we're talking about a chronic problem. We're not speaking about you get hives once a month. That's different.
All the time.
We're talking about something that's either autoimmune, something that's chronic, something that you can't pin down. Then we do one of these elimination diets. And again, it is, as you've been pointing out, it's something that I recommend people do under the guidance of a physician, because let me just tell you, some of these problems that we're talking about, if you're not being monitored by a physician, you get into big trouble if you're not moving in the right direction.
So let's go through some of them. You have categories here. You have level 1, level 2, items always permissible. What are the items always permissible?
Well, basically, when we talk about items that are always permissible, the elimination diet regimen that I have on the website, on the Compass Health website, is something that has worked for me in my work with patients. There's evidence that supports it, but it's also based on your clinical judgment. So what's on my diet here for always permissible, for example, under grains, is simply millet.
Millet, no one's allergic to that.
Well, I wouldn't say that no one's allergic to it, but it's a very infrequently used grain in the human population. Most people that I deal with have never heard of millet as a food. They've seen it in the bird food maybe after I point out to them what it is. But millet is actually a very palatable grain. It can be cooked like a hot cereal. And one of the theories of allergy and intolerance, Don, is if someone is predisposed to one of these conditions, the things that they are repetitively exposed to are things that they are more prone to develop an allergic response to.
Okay, so you cut out the things they normally eat in terms of grains like wheat.
Yeah, high on the list, the things that we always exclude are the gluten-containing grains, so that would be barley, rye, oat, and wheat. Okay? So those we exclude. Doesn't mean people can never eat those again, but during the elimination phase, we're trying to get them off multiple foods, see if their symptoms improve. If they do improve, then we gradually start adding foods back. If one of those foods triggers the problem, whether it's
you know what it is then.
Yes, then we've
so
got a
the
good
level
idea.
2 you have down here would be corn and rice.
Yes. Level 2 are things that we'll add back sooner. So in other words, rice in particular tends to be a less allergenic grain in our culture, in the Western culture. Now, it may not be true in Asia. I haven't worked there, so I can't tell you that.
Then the next category, you have nuts and seeds and legumes.
Yeah, the nuts and seeds. Nuts in general are fairly allergenic. And so you'll notice here, all nuts are excluded. You don't add those back, including peanuts in that as well, although it's a legume. You'll also notice that with the other legumes besides soy we exclude completely in all these regimens. If we're not doing as strict as an elimination diet, we may allow other legumes. So it's, garbanzo beans or lima beans, lentils. We may allow those in a less strict elimination diet program.
And some of these, it can really cause problems. I mean, I heard about a young girl who just was exposed to a little bit of peanuts and was a very, more severe problem than hives. I think she actually died from that.
Yeah, she had an anaphylactic reaction. I mean, got a lot of media press some time ago. But it's exactly true. That's how serious these things are. So we're not recommending that you challenge yourself with foods that you've been avoiding, especially if you have serious or life-threatening allergic problems.
So you have other things listed. We can't go through them all. Other animal products, dairy and eggs, fruits, vegetables, and you have them in different columns. A category, level 1, level 2. I guess level 1 were things that you always should avoid.
Well, at least if you're doing the
study.
kind of elimination diet strategy that I'm recommending.
And then water, and then other things. On that level 1 or other, you have chocolate, yeast, alcohol, all kinds of
Well,
different
since you
things.
mentioned water, we need to let everyone know that we're actually not telling you can't drink water. But it's toxins that can be in water, other poisons, and I use that term somewhat broadly, but it's true. There are many compounds that get into our water, whether it's the products of chlorination combining with other compounds in the water or traces of pesticides and things. So the message, distilled water with charcoal filtration is probably the single best option if we're dealing with these regimens.
And then you have other tests there on the site that you can go to that are like, an ANA blood test and different types of blood tests that if all that elimination doesn't work, you can look at some other things.
That's right. Sometimes the reason why we're speaking especially, in this show about hives, sometimes people have hives, they have autoimmune diseases or autoimmune conditions. ANA is a test that most people think of in association with lupus, but it is something that can give us insight into autoimmune processes.
Can stress cause hives?
I think a lot of people would say yes. We've spoken about cholinergic urticaria. I mean, that does, the name would even suggest that it does that. But I have to be honest with you, I have never seen a person in my experience who had hives caused by stress.
All these different things, we discover what it is, we take it away. Any spiritual insights into hives? I know you're a Christian clinician.
Well, I think it's interesting that you mentioned taking things away sometimes be a blessing. Many times we think, in Christ we're free, we're in liberty. I mean, Paul speaks about that experience. But at the same time, God sometimes asks us to give up things that are only hurting us. I think it's a good principle to keep in mind.
Thank you, Dr. DeRose, for dedicating your life to, many physicians are just day in, day out seeing patients, and the word doctor means teacher, and you're taking that seriously too. You're teaching lots of different groups. We appreciate that. We appreciate the website, compasshealth.net, and what you're doing in your ministry.
Thanks so much.
Thank you for joining us on Health for a Lifetime. Go to the website, compasshealth.net. You can look more closely. We hope as a result you have health that lasts for a lifetime.